OTPF-2 versus OTPF-4. Simple comparison for students and clinicians. The Occupational Therapy Practice Framework, OTPF, evolves over time to reflect deeper understanding of occupation, better alignment with practice, and clearer documentation standards. Here's how OTPF-2, published 2008, differs from the newest OTPF-4, published 2020. 1. Structure and terminology. OTPF-2 focused on domains and process. Occupations were listed more simply, and categories weren't as detailed. Used performance skills, performance patterns, and contexts, social, physical, cultural. Emphasized the process of evaluation, intervention, and outcomes. OTPF-4 still uses domain and process, but far more detailed and occupation-centered. Updated terminology for clarity and inclusion. Client factors and performance patterns clarified. Context now includes environmental and personal factors separately. Strong emphasis on occupation as the core of OT. Greater clarity on documentation expectations. 2. Occupations. Category OTPF-2 had 8 areas of occupation, but definitions were less refined. For example, it used education, work, leisure, play, and social participation, but without expanded subcategories. OTPF-4 refines occupations with explicit definitions and examples. Greater detail in ADLs and IADLs. Health management, new in OTPF-4. Expanded social participation, clearer examples help guide goal writing and documentation. 3. Contexts and environments. OTPF-2 combined context environment together as context. OTPF-4 splits into 2 categories. Contexts, personal factors, age, gender, habits, experiences, environments, physical, social, cultural, virtual, etc. This separation improves clinical reasoning and documentation related to barriers and supports. 4. Health management added, major update. OTPF-2 health management was merged under ADLs or IADLs, not clearly separated. OTPF-4 adds health management as its own occupation. Example: medication management, symptom management, sleep, nutrition, physical activity. Huge improvement for documenting self-management, chronic disease, and wellness. 5. Documentation and outcome clarity. OTPF-2 more general guidelines did not emphasize documenting occupation-based reasoning. OTPF-4 strongly stresses occupation-based intervention. Client-centered goals linking everything directly to functional engagement helps therapists justify medical necessity much more clearly. 6. Professional language updates. OTPF-4 includes updated definitions for activity analysis, occupation, and therapeutic use of self. Stronger focus on interprofessional collaboration. Increased emphasis on advocacy, wellness, prevention, not just rehabilitation. OTPF-2 does not emphasize these as strongly. 7. More inclusive and culturally responsive. OTPF-2 does not address diversity, equity, or cultural responsiveness in depth. OTPF-4 integrates inclusion, diversity, cultural responsiveness, contextual influences on occupational justice, helps therapists better address social determinants of health. Quick summary table feature. OTPF-2 OTPF-4 publication. Year 2008. 2020 occupation categories 8 areas. Less detailed expanded. Added health management, context, environment combined separated. For clarity, documentation clarity. General strong emphasis on functional. Occupation-based documentation, cultural responsiveness. Minimal explicit and integrated examples and definitions. Fewer expanded examples for all categories. Interprofessional focus, limited strong medical necessity. Support weaker, stronger. Better for goal writing and reimbursement.